and a natural tendency we have as Kentuckians anyway.
Don't forget, we're the first state to have a Department of Mental Health ever.
Oh,
MHA was doing the advocacy that created that. So yeah, we were the first. So
Marcy, make sure you get that in, because that's a great thing. Yeah. Okay, good. All right, so everybody's met Jessica Fletcher. She's our fearless leader behind the curtain.
Yep, and I am hidden behind the curtain now. We've got 10 people in the waiting room, and I have us streaming on YouTube so we can archive this. So if you're ready, Bridget, we're about 30 seconds out if you're ready for me to let people in.
Okay, yeah, let's do that.
Okay. Okay, everyone, we're live.
All right, great. I see some familiar faces already. Good to see so many of you joining us again this Wednesday for our second renewed episode of Innovations. You'll recall we kicked this off the first week that we were all beginning to shelter at home in COVID. And then we were trying to have conversations to just help alleviate some of the uncertainty and provide an opportunity for Kentuckians to ask questions of our leaders, to deepen their understanding of response and what they could be doing at the local level. And we took a break through the fall and the winter months as we kind of felt we'd probably exhausted the conversation at that point. But now as we begin to come out of COVID and we're all really thinking about recovery, education recovery, community recovery, and building a new foundation for, especially for our part, for education in the state. We wanted to start having these conversations again with leaders at the state level, leaders at the local level, to begin to unpack some of the issues we've learned are most prevalent as a result of COVID. Our learning came about through a series of surveys that we've done in the last year, surveying students of all ages, post-secondary students and families, teachers, parents, early childhood providers, and families needing early childhood to better understand the impact that COVID was having on them, all in service to positioning us for recovery and for innovation through COVID and coming out of COVID. So one of the things we learned throughout that entire series of surveys is that mental health, social emotional development is a significant concern for families, for students, for teachers. And so today we wanted to have a conversation with mental health leaders in our state. And we're pleased to have Secretary Eric Friedlander with us from the Cabinet for Health and Family Services. Welcome, Eric. He's saying, thank you.
Thank you. There we go.
We go. Great. All right.
The most overused phrase of 2020.
Yes, we're familiar with seeing you behind the podium there in the daily updates. It's great to see you today.
Thank you.
We also have Marcy Timmerman with Mental Health of America here in Kentucky. Marcy, thank you for being with us today. If you want to shout out to folks.
thank you. Good to be here.
Great. And we have Goldie Williams, who's with Morehead State University. Welcome, Goldie.
Hello, thanks for having me.
You're welcome. Thank you for being here. And last but not least, certainly Amy Beal with Campbell County Schools in Northern Kentucky. Welcome, Amy.
Hey everyone, thanks for adding me.
Great. So we're going to jump right in, and all of you joining us, please use the chat box to ask questions as you have them, because we really want this to be a service to you as you're thinking about your conversations that are happening locally, how you can have an impact locally in ensuring mental health services, the right mindset about social emotional development is present in your community. So fill that chat box with your questions. And we'll get those answered. And if you have resources you'd like to share, please feel free to pop those into the chat box. And we'll do the same here from the Pritchard Committee standpoint, and certainly support our panelists in sharing their information. We'll probably spend about 20, 25 minutes in a panel discussion to kind of get the top thinking from our panelists out, and then open it up for questions from the chat box, and for each of you to ask your questions in person, as it were, here on Zoom. So without further ado, Secretary Friedlander, would you just kind of give us a general understanding of how you're thinking about mental health in the state right now, the needs, and how the state is responding to those needs?
Great. Thank you for the opportunity to speak today. Behavioral health is something that is critically important. At the Cabinet for Health and Family Services, one of our main pillars is about resilience, and that resilience really does relate to the trauma that both the folks who work for the cabinet and the folks who oftentimes come to the cabinet for resources. And that's a major piece that we're going to work on. And embedded in that is really an attention to behavioral health services. So we know we have never lived through anything like this before in our lifetimes. No matter how old you may think I am because of this beard, I was not alive in 1918. So this is something that's really new to us. And how we've responded, I think, has been as well. When you look at our state, when you look at our health, when you look across the country, we've responded very well in Kentucky, and we've responded also with changes to some of our behavioral health systems. We've allowed a lot more telehealth. We've taken prior authorizations away relative to our Medicaid program, which serves over 1.6 million Kentuckians, so 1 in 3. We have also then really redoubled our efforts in terms of our collaboration with the Department of Education and how we can provide those services within the schools. I'll talk about it in a little bit later, but we really want to make sure that we address what we're seeing as some increased need, right? We're seeing some increased calls to our suicide hotlines, slightly increased, but a higher acuity. And so we really need to be able to respond to that in a very direct way with the provision of services. And we all know in Kentucky, we didn't start out with an overabundance of providers and services, right? We did not start there. We started there with a shortage, and it's only going to be, unfortunately, a little more acute moving forward, as we know what people are calling going to be the fourth wave of the pandemic, which will really be, what are those behavioral health decompensations, or really what are those behavioral health challenges that we know we're going to face for folks who haven't presented before, certainly. And then what does that kind of isolation do? What does that lack of socialization do? So those are all things that we're going to have to be acutely aware of coming out of the pandemic, because all the studies show this next 6 months to a year, we've made tremendous progress. We have made tremendous progress and so much vaccination. And the great news of 12 to 16-year-olds being able to be vaccinated now with the Pfizer vaccine. But we are coming out of that. And coming out of that, we are going to definitely see greater behavioral health needs. So that's something we all need to be prepared for.
Yeah, Secretary Friedlander, really appreciate that comment. As I know we're feeling that here at the Pritchard Committee as a team. My family is certainly feeling that, and I'm sure everyone on this in this discussion is feeling that as well. That there was quite a transition going into COVID, but the transition coming out is no less significant, and the uncertainty and how it impacts us is no less significant than it was going in.
Absolutely. We think it's actually going to be more complicated figuring our way back out in a way that builds back better and supports folks as on the other side of this, on the other side of a trauma. That's going to be as complicated as and more long-term than how we came in.
Yeah, and I appreciate that you use the phrase "on the other side of a trauma." This has been a collective, universal trauma that we've all experienced. So are there lessons from trauma research that you're pulling into kind of how you're thinking about how we respond as a state?
So the lessons coming back out and trauma research really have to do with some of the supportive factors and how to increase some of the supportive factors, as well as that then additional provision of service, right? And making sure that folks, again, it's the things that we've worked on, right? The taking away of stigma, the making sure that folks can have access to those services, that we can make sure that folks get paid for those services, as well as when they provide them. But it is not being afraid to ask, demonstrating that everyone has gone through this collective trauma. What I've said oftentimes in many different venues is what I hope the lesson we learn from coming through this experience with COVID is that whatever happens to one of us in our communities impacts us all. And so we have to be concerned with behavioral health needs coming out of this, because a vast majority of us are going to have those needs as we come through. So it is, how do we make sure that we have as broad a coverage as we can, while keeping in mind that there are preventative factors and supportive factors that we're going to have to continue to build in partnership with the schools, through family resource centers, with school-based services. What are those options that we have? And now that we can focus on what is that behavioral health service that will be needed, because I think everyone is going to see that and understand its importance.
So, Secretary Friedlander, specific to the federal stimulus dollars or the federal recovery dollars, what dollars can we expect coming into the state from the federal government to support increased mental health services?
The biggest, always within the Cabinet for Health and Family Services, the largest funding stream really does come through the support for Medicaid and behavioral health services, and that's an increased. It's an increased rate that the federal government pays us. Like I said, we are leaving prior authorizations alone, and we will be encouraging school-based Medicaid services. There was free care. It was launched prior to the pandemic, and so the regulations are in place. People have started billing. It's an important piece that folks can do, and you can go to the KDE website and look up school-based Medicaid services, and you'll find it there, and an explanation of how to get there. Again, just great partnership with Department of Education. The other piece then is through our comprehensive care centers, our regional mental health centers. They have funding to look for and try to find, in particular, children with severe emotional disturbances, right? But they have the funding and support to be able to partner with schools for some behavioral health services, some behavioral health consultants. I would encourage departments to really work with their local regional mental health authorities, their local regional comprehensive care centers is what they're called, and reach out to them. And because I think you can come up with some really intriguing partnerships. You can also do that. That's the primary way. But then there are other places like federally qualified health centers that may be able to provide some support, and local health departments that may be able to provide some support, but they're really moving away from the clinical model. So I would say the first choice is the CMHCs.
Okay, great. Secretary Friedlander, thank you. I know we'll have some more questions for you as the conversation unfolds. And I'd like to turn attention now to Marcy Timmerman with Mental Health of America here in Kentucky. And Marcy, share with us a little bit about your organization and what you've seen the last year regarding mental and behavioral health, social emotional development.
Well, thank you for having us. Mental Health America of Kentucky is the longest serving mental health advocacy organization in the state, but we've got a little smaller over the last few decades, so some folks are still meeting us for the first time, and that's fine. One of our big advocacy legacies is actually the Department of Mental Health in Kentucky was started here. As soon as President Kennedy signed the bill and allowed it, we had the structure already because of the advocacy of MHA, my predecessors there. So thanks to them. But now we are really working on upping upping our game on education. It is
So
mental health.
Marcy, I want to stop you there. And just for our listeners, I want you to underscore that Kentucky was the first state in the nation. Say that again, because it deserves, I think, a round of applause and pride.
We were the first state in the nation to have a Department of Mental Health when those funds became available federally. So we are definitely to be applauded for that. Yes. That was a big deal. And then we kind of fell to 47th in funding. So we got to work on that, right?
All right.
47th or 49th, depending on your numbers you're looking at. I'd say 47th. So we've got a long way to go, but we have some other innovations that we're working on, right? And I'm sure Secretary Friedlander will bring those up. But yeah, as an organization, we really are pushing Mental Health Month right now. That started in 1949. So if you aren't on board with Mental Health Month, please get our toolkit. I will drop that in the chat. It's mhaky.org, and you can find it on the front page because we're so proud of it. Our toolkits are actually created because of COVID-19 right now. They're called the Tools to Thrive. We had one last year. As soon as the pandemic hit, we were like, oh, scrap everything for Mental Health Month. It's going to be a different year, right? Than we thought it was going to be. And so we brought out these tools to thrive, and they're really cognitive tricks and tips for everyone. They work for people with severe mental illness. They work for families. They work for children. They work for adults. And I think that's important to underscore, that there's a lot of tips and tricks that can be used your whole life long, right? And we really belong to that idea of before stage 4. So we want treatment to happen before people get so sick that they have to be hospitalized or jailed because of a mental illness. And on average, it takes about 10 years for someone to seek treatment for their mental health issue. That is way too long, y'all. We can fix it in that year 1, right? A lot of times, just a little couple visits to somebody can fix a problem, or at least identify a problem and let us start treating it before it gets so bad that you're stuck in a hospital. So definitely we're here for that. We have mental health screenings available online for that reason. They're mhascreening.org. We have 15 screenings out there. They cover, including a parent screening, which I think is really helpful. Because if you're not sure what your kid is going through is something that needs to see a mental health professional or not, right? There's a lot of people out there, I don't know when it's time, right? That is what you do. You go take a screening, get an idea. Our screenings also offer DIY at home tools. So maybe you don't need to see a therapist. Maybe you do, and there's a waiting list. They still have tools to help you based on what you answered in the question. So things like stopping thinking traps. That's one of our Tools to Thrive toolkit things, but we have more information in our screenings on that. So, they kind of link up together. Our toolkit is good for everyone, though. COVID-19 has hit us all. As you said, it's a community-based trauma, right? And so it's a community response that's needed. And I think the more of us who are equipped with that information, the better. We also offer things like mental health first aid training. I have adult and youth. I offer both of those virtually. So if anybody's interested in being a listener and a noticer and knowing what to exactly do, we can teach you that through that class. It's about 8 hours of content for each of those. So those are just some of the ways that we help. I hope that answered the question.
That's great, Marcy. Thank you. I'm going to go ahead and ask a question that's in the chat box of you and Secretary Friedlander, if you also want to jump in on this. And it's from one of our team members here at the Pritchard Committee, Benjamin Gies, who is our new Director for Early Childhood Policy and Practice. And Benjamin asks, could this be viewed as a collective ACE, adverse childhood experience for all children? Does it match the ACEs framework? So Marcy?
Okay, I would say sort of, right? ACEs are independent, individually affected. So for some people, what they went through in COVID will be an ACE, right? Not everyone will. Not everyone responds to the community trauma the same way. I think that a lot of the post-trauma information we have, so that trauma-informed care piece, that trauma-informed training, the responses we have to ACEs are probably, a lot of those are scalable to our general community. And I think that would be my answer, is sort of, right? And I think we should use what works. And if something's not working, stop, right? But go ahead, I'll let the Secretary.
Right, Secretary?
You said it very well. I don't think the ACEs framework is certainly based on individual experiences. So to be able to say that, the experiences that individual children have could indeed be reflected based on that experience, but it is not necessarily built for community or collective trauma. So I think that I think we can consider it as a piece of that collective trauma, right? And then that challenge to how we work with providers, and I think we are going to be building evidence-based practices really as we learn coming out of this pandemic.
And the front line of those evidence-based practices, I'm guessing, would be some of the things we already know about supportive factors, strengthening families. So
Evidence-based, trauma-informed, even beyond that. So we talk about trauma-informed in the cabinet, but we also talk about secondary trauma. So for those in schools who are teachers, right, who will be experiencing the children in their classroom who have experienced some trauma, right? Making sure that we take care of the teachers who are in these situations where they may be responding within a classroom. We have to be very, very clear that it's not only the individual, but it's the individual responding and providing services. Those two things, you can't separate them. You have to think about both together.
Great. Secretary, thank you. And I think that's a perfect segue. Amy, I want to pull you into the conversation at this point. Amy Beal is a comprehensive school counselor for Campbell County Schools and also the 2020 Kentucky School Counselor of the Year. So Amy, reflect on the last year and how Campbell County Schools is preparing, or I guess is already responding to kids being disconnected, now coming back into school, and what you're thinking about as we go into the summer months and next school year.
Sure. Thank you. So I guess in some ways we were we had a lot of pieces in place already prior to COVID. There was definitely some scrambling to figure out how we could serve folks virtually because we hadn't done that before. But we had, as a district, over the last several years, worked on small pieces in building up those supportive factors across all the different levels of adults in our district. So we've done. We've worked on ACEs, and that was a district-wide. We spent a couple of years district-wide. For example, our bus drivers, our custodial staff, our cafeteria staff, everyone was trained on what that looked like because we all have different relationships with the students. We see them at different times, and students feel more comfortable with different folks. Our cafeteria staff, our custodians are great friends, great resources for our students. The lunch or breakfast is one of the fun times in their day, and they do share out information with them, or they might notice so-and-so is down today, and then they'll report that to either a school counselor or a teacher or a principal, and then we take it from there. So we shared that out across all of the employees in our district, and I think that was really helpful to have common language and a great foundation to start from. We continue to, each year we have cadres for our certified staff. We've done a poverty cadre, we've done a homeless cadre, we continue to do the trauma cadres, and each year that pulls maybe 20, 25, 30 different staff members in for a year's worth of training on what more in-depth training, what that looks like across those areas. So that's something that I think we did prior to, which helped have, again, that common language. During COVID, there was some, again, we were able to work out virtual situations. We're fortunate enough to have a few clinical mental health providers in as part of our district staff, and they were able to continue doing the telehealth check-ins with their students. School counselors, we could continue doing check-ins at home with folks that requested it. We had done a lot of things with Google I'd never done before, lots of different ways to reach out and connect with parents. We have a communication system that we use. We have several. The one that we use the most frequently, and the most parents involved in, is our Class Dojo system, which is a free app. And about 99% of our parents have logged into and started accounts there. So it was real easy to get messages out to people what was happening and that kind of thing. Going forward, you were just talking about funding. So one of the greatest resources we had was we had a National Institute of Justice grant for 4 years, and that allowed us to onboard several more comprehensive school counselors. That grant ends this year.
Oof.
So unfortunately, we are not going to have as many school counselors as we've had in the past. And then, but I'm listening to Secretary Friedlander talk about all of the things that are coming next year. And, that's definitely a concern that we have, because we know there are going to be more needs, and how are we going to reach all of those needs with less school counselors now? So that's something I haven't had to deal with before, and that's something our district hasn't. So we're navigating through that. This is a fresh new issue for us.
Yeah. So Amy, if I'm listening in on this webinar from elsewhere in the state, and I'm thinking about the priorities that need to be present for my school, district, or community, what top 3 things would you say a school, district, community need to consider as important mental health supports right now?
So inside of the school, I think priorities are communication with stakeholders. So that's number 1 for school or district. Inside of our building, the next most important thing is developing a positive, safe, and supportive culture and climate. I feel like as a school counselor, that is my top priority, and everything else filters out of that. And I feel like at the district level, that needs to be the same thing. It's just done a little bit differently at the district level. So those are the things that I think are, and just a lot of the continuing education. There's been so many great webinars and just pop-up things that I get emails every day, and I try and participate in as many of those things as I can. The trauma, again, the ACEs is an individual piece, but this COVID has been a collective trauma, and we've fielded more phone calls from parents than I think we've ever fielded in the past. And it's, please help, I'm not sure what to do next.
Yeah.
So that's
So
definitely what we've seen a lot more of.
Back to the communication piece being so important in this time of uncertainty. Amy, thank you. And I know we'll have some more questions as we move through the hour. I want to move to Goldie Williams, who's here with us from Morehead State University. And Goldie is the Director of Counseling and Health Services for Morehead State. Goldie, we know from our survey of post-secondary students that mental health has really been an issue for them.
Yes.
So share with us how Morehead has responded to that need and what you're thinking about moving forward.
Yeah, so thank you for having me. I hope this information will help someone out there. So for us here at Morehead State, I think one of the things that benefited us was that we co-house mental health with our medical services in one clinic. So starting in January was my first recollection of anything COVID. So from January 2020 forward, I have been extremely focused on COVID. So that has helped us. We went from 11 staff people in this clinic to 17 at the height of where we have been. Our space was sufficient that everyone had a private office, which really helped us. And we actually developed what was called the COVID response team, the campus-wide COVID response team, by hiring 5 people from St. Clair Medical, 4 nurses, and 1 medical records clerk who did our COVID response. So we had a combination of mental health, physical health, and COVID response all under one roof. And we have been here the entire time. We were essential staff. We had times that we locked the door and the student had to call in for an appointment to decreased hours of operation to times when we were all 17 here in the building. The key thing was that the staff were flexible. They worked with me and they stayed the course throughout this entire pandemic. We have been here and we've maintained in-person operation except for a few weeks in the spring. We have maintained some in-person operation, which I'll talk more about, which has helped us. In total, since the beginning of this, we have only had one occurrence of a COVID positive student in the clinic that forced one person to quarantine for less than 1 week in total. And we have maintained our operation, and we've done that by some due diligence that I can talk about. We started a mask mandate in March of 2020 because the research and the CDC guidelines were there, and I got permission from the university for medical services to require masks for all students entering the clinic. Then in May of 2020, that mask mandate went for counseling as well. We have had no complaint from students whatsoever during this entire time. They completely complied. They did not give us any problem, and masks have been worn. They're still being worn today when students are in the clinic, and staff wear them in the clinic unless they're in their private office alone. If someone comes into my office, I have to put my mask on. The first switch we made, the mask was the first switch, but the second thing was I requested full-time cleaning. So we have a housekeeper, facility management person that works on our floor all day, every day. So she went from cleaning the entire building to cleaning our floor. And that has helped us control any transmission through surface contamination, also through the air, because we've used a great deal of Lysol. We began triage of our phone calls back in March of 2020. We continue that today. We've now downsized it to a series of 3 questions that 100% of students are asked. If they indicate yes to being COVID at risk, then they're offered a telemedical or a telemental health appointment. The other thing that helped us on the counseling side was that we developed an informed consent agreement that counselors went over with students. And this informed consent talks about the risk of in-person counseling to the student and the staff. It also talks about all the measures we've taken to protect them and protect us. I'm willing to share this 3-page document with the group. I can send it to you afterwards. But
Great.
It really told the student, this is what we're doing to protect you, and this is what we need you to do to protect us. And we signed it. We gave them a copy of it. And I think it really set the tone for us.
So Goldie, you really felt like then some of the mental health strain, it sounds like
Yes.
you were feeling like so much of the mental health strain was maybe coming from uncertainty among students as to how Morehead State was responding to the pandemic, and if they were in a safe place.
Right. The staff needed to know that we were safe, and we were adhering to their safety first. That's the first thing. I had to make sure the staff knew they were safe and that they were valued. And
especially because you've got college students who are still coming to dorms, leaving home, coming to dorms. They needed to have this sense that they were being cared for with as much thought as they would be if they were at home.
That is exactly right. And we knew we were dealing with a very high-risk population for COVID. So we were having honest conversations with them, and we still are doing this today. And we just phrase it that we're going to work together to do this to benefit us all. And then I would say the next big switch was telehealth. And we had counselors trained by May of 2020. And telehealth is now 60% of our service delivery. I went back and looked at the fall 2020 numbers, and more than 60% of all services we were delivering came through telehealth. We've made that change successfully. We've also increased the number of services provided. I've got the numbers for that for the fall of 2020 compared to the fall of 2019. We did provide more services. I can't say that there was a link that there's more need because there was COVID, because there were a lot of other factors that were in play that caused that. Does that make sense? The other big change was that we have 100% of everybody on this clinic floor fully vaccinated. And we have that sign posted at the door so that students know that they're entering an area that's 100% vaccinated. We're still taking daily temperature checks, logging that, and if workers are sick, they're asked to go home. So that's a good list.
That's a great list, Goldie. Thank you. If I'm a parent, I know my child is struggling in this time of uncertainty on their college path, or even I'm a parent of a high school student trying to make that decision about whether or not now is the time to go to college. What do you say to parents across the state about supporting their young adults' mental health in this moment?
So I have been a believer from the beginning, and I'm still a believer that we have to continue as close to our routine as we possibly can. There were times that we lost our routine, but as today, we need to be back in that routine, and students can come to campus and be safe. Is it going to be difficult? Absolutely. This has not been easy. And going through the numbers for the fall of 2020, our COVID response team connected with about 10% of our total population that came to campus. 10% were somehow connected with the COVID response team, which means that they were either tested positive, they were placed in quarantine, or they were awaiting test results, or they were physically sick and needed to be quarantined until they got a test result to show they were negative. 10% is a huge number, but the other 90% of the students need to know that it's safe and that all these measures are happening so that the environment is safe for them. And I do think that we've managed to do that here at Morehead State.
That's great. Goldie, thank you. One other question for you before I want us to move into kind of a question and answer period. So I will first kind of look at the chat box and ask a couple questions out of there. If you're on screen, I might, ask you to ask that question so that you can engage with our panelists. And please feel free to raise your virtual hand if you have a question so that we can let this be a conversation. Goldie, my last question for you before we move to that part of our conversation is, are you hearing from students kind of fear and uncertainty about the economy, about what they're doing in post-secondary education right now, and just fear of the unknown as they think about their future at an important developmental stage as young adults?
I think yes, but I don't know that it's coming out that it's a fear of the financial outcome or that what they're doing is going to pay off. I think we've hit the point right now where what we were seeing was depression and just lack of hope was the point that we ended the year at. So in August of 2020, we were seeing heightened anxiety, which then went to depressive symptoms, which is now more apathetic. I don't care. I've kind of lost interest in things kind of attitude was the collective response that I gathered from my clinicians that they were seeing. That's the pattern. And I think that's leading us to think we're going to have an increase in PTSD.
Goldie, that is so helpful. And I'd love for us to make sure we kind of bullet that out in any information we get out after this, because I think that's eye-opening for parents and citizens in general, just to think through that frame, even for ourselves, struggling with a lack of hope, heightened anxiety, and then just like throw your arms up, like I just need to like not care for a while. And I think we've probably all experienced that through a year of COVID, different moments. I see Secretary Friedlander and Marcy, but I think this is, as we have these conversations, reflecting on our own struggle through this time and knowing that others and our young people are feeling that same sense of struggle, and it may not be wholly linear. So tuning in, I guess, empathetically to these feelings, yes. Lack of hope, anxiety, lack of and getting to a point where you're kind of indifferent, I guess.
Yeah,
Thank
we're
you for
actually
that.
Seeing some quantitative data from our screenings about that. Our youth are angrier or more blah, right, as they might have said on our screening. So just seeing that crossover. And then our LGBT students, our youth 18 to 24, are showing a lot more anxiety, a lot more fear and inclination to stay home and stay closed off. So just something to think about.
Oh, Marcy, thank you. Secretary Friedlander?
No, I don't have much to add to that. I think that as being able to reach out to somebody, right, and reestablishing community, because some of this is really going to be about reestablishing community and support. That being able to do that, and for each of us to be able to do that, and each of us to be able to be that support, that's what will provide, I think, the very basic level support there, and some of the tools that are available through the Mental Health Association, also through some of our websites. I'll plug our behavioral health websites, and certainly there are some through the University of Kentucky. There's a trauma center there. So I think that there are some really good resources within the state that can be quite helpful for that.
Great. Thank you all. And so like last question, I said, Goldie, my other question was my last question, but this prompts me to ask another question of all of you, because I think everybody's eyes were popping open on that last piece of discussion. What can we all do to help instill hope in ourselves and others in this moment to get back to the level of energy and hope we need to feel and give to others and receive from others?
If you don't mind, the governor has said it really well. I've been on a couple of calls with him. We have these vaccines rolling out. There's all this hope about, where there's the hope, right? The vaccines are rolling out. We've got like half the population or half the eligible population vaccinated. This has all happened within a year. It's amazing. Science is amazing. It's why we need to believe in it and not conspiracy theories. But there is this hope of getting back to that community, right? But at the same time, right, there are going to be folks with survivor's guilt, right? We know what that is. We see that. What are we coming back out to? What is that change? You addressed even the economic side of that, but it's as basic as community. What's my school going to look like? What's my classroom going to look like? We don't have the definitive answers on that. So that uncertainty really is a lot of what drives some of, I think, the anxiety. So those are the pieces that I think we just need to stay tuned in with each other as a community, and then be able to know that that's what we see within ourselves, and find those resources that can help. Hope I answered your question. But yes. I mean, it is that kind of juxtaposition of, there's a lot to be hopeful about. The economy's kind of starting to roll, but we don't know it until we actually can get out and experience it, and then that's the unknown.
Yeah, that's great. So unpacking uncertainty, creating more certainty. And Amy, I'll pivot here to you on this question of hope, because it caused me to reflect on what we were learning the first couple months into COVID, that while everyone was going virtual, teachers and students were finding new ways to connect. And one of the bright spots was actually enhanced relationships in the early months of COVID, even though they were online. So maybe a comment on the importance of those relationships as we're trying to spark hope.
Oh, definitely. That's what all of this is about. This is about relationships and connectivity. And as human beings, regardless of our age, we need to be connected to other people, and acknowledging the change in connectedness is important. Understanding that we feel differently because of the way these things are happening, and that's okay. So normalizing the fears, the uncertainty that people of all ages are feeling, and normalize it for parents, that it's okay that they feel this way. Their children are going to see that. Same thing with teachers, and our students are seeing that. So the one thing that we have talked about a lot and over the last 12, 15 months has been self-care. Whatever you need, to take time for that, and your needs change, and experiencing emotions is important. Sharing those with whoever your person is, or if, whatever that looks like, journaling or reading or art, whatever that is, figure out what you need and take little breaks, because otherwise our brains are just going to explode. We've all been on overload for so long. Just take a deep breath and pause and try again.
Amy, thank you. So we need to put the oxygen mask on ourselves so we can help others, right? Harkening back to air travel when we used to do that, right? All right, so a question, Becky, maybe I can call on you to ask your question that you popped into the chat early on about students who are disconnected.
Hi, yes. So just from a perspective of a board member, we're starting this conversation. Mental health is actually a reoccurring board item on every meeting. So we're going to discuss it regularly, whether we want to or not. But I'm curious about at what age do we start reaching out to these kids? I know we think about middle school, high school, but I'm really thinking elementary. I mean, I even want to say preschool. Am I off track there, or what can you say about that?
What I can say is you are not off track. We have some mental health associates that actually work with our child caring facilities. So you're talking about very young children, and we've seen it more and more over time, very young children who are displaying behaviors that really belie something that's happening with their behavioral health, and can even show pretty significant behavioral health challenges like 3 and 4 years old. That's not, people may think that that's just wild, but it is absolutely true. So being able to target that and spot that early, I think is obviously we're about early intervention and prevention. As we're able to do that, you can have greater impact from there forward.
Thank you.
Can I add something to that, Bridget?
Yes, please, Goldie.
Yeah. So thank you. I've been here at Morehead State now for 15 months. After being retired for 15 months at home, recovering from 29 years worth of work in human services here in Kentucky. So I've been a state child protective service worker for 5 years, and then I worked in community mental health for almost 25 years. So that 29 years of collective experience told me that we were seeing maltreatment of a vast majority of Kentucky children. That highlighted with the opioid epidemic and the fallout from that opioid crisis that is still occurring today. So my thinking when I took this little job that I thought was going to be wonderful, and it truly is, was that I would deal with students that were very smart. They're not going to be as damaged from all the damage that I had seen in my 30-year career. And boy, was I wrong. It followed me. It's here in this post-secondary education environment. We added the ACE survey to our assessment, but I talk about that frequently. The majority of students that we are serving have ACE scores of 4 or higher. The majority. We will see the fallout for years to come about the maltreatment of our children in Kentucky. So we have to be able to respond to that, improve their skills, improve their survivability of trauma. And I've tried to do that over this last year with COVID, because COVID, on top of that trauma, has exacerbated the problem.
Great, Goldie, thank you. We have a question from Tasha Jones in the chat box here. And Tasha, if you're able to be on screen and want to ask this question, please jump in or respond to it. It is about how we connect those kids that we've not been able to connect with virtually and maybe in home visits. There you are, Tasha. There we go. Jump in here.
Yes, it was more or less Tammy answered my question was to how engage into those families that we cannot connect to at all virtual or in person. And as a board member, you don't know those families directly, but you hear about it in your board meetings that 33% of the families you're not getting to. And that's a big percentage, especially for a small district like us. So we're wondering, how can we get to those families and be sensitive about getting to those families without directly going to mental health, COVID, and whatever traumas they experience, in a more sensitive way,
Yeah,
than a
Tasha,
lot of data research.
you're on the Frankfurt Independent Board of Education, is that right?
Yes, ma'am.
Yes, okay, so background there, and just Becky is on the Gallatin County Board of Ed. So thoughts from our panelists about how we reconnect those disconnected youth and families.
Well, I would be remiss if I didn't talk about family resource centers in the Health and Family Services Cabinet, right?
Good job.
Who are often connected to these children and families who may have greater challenges, right? And we've been talking with our coordinators and with our regional coordinators about how we can be of assistance to our districts when we need to reach those families, because we may know who they are in family resource centers, and we may be able to do some of that outreach. So I would suggest then part of that is being in partnership with your family resource center coordinator.
Thank you, Secretary. Marcy?
Sure. I'd like to add that I would love to see more mental health counselors, more social workers, psychologists working with the Frisky directly. I think that the more we embed them in primary care and in our schools and other places, the more that stigma erases. And the more we start talking about trauma on major groups like this, the more we demystify it, right? The more we learn to recognize it and explain it. So having that as an agenda item every single meeting is really important. Whether it kind of gets a little old and you're like, we're not making any progress, you really are. Because I'm going to tell you personally, from someone who goes to a lot of health fairs and was run away from because mental health is in our name, right? People are coming to us now. They're not running away at the same rate. So we're starting to chip away at that stigma. And I think we just need to keep doing that.
Marcy, I would just want to flag that important innovation that you just mentioned from a solutions focused standpoint. Are we really incorporating at the local level into some of our work and our conversations, those experts in mental and behavioral health? So kind of a flag, right, for innovations. And as Secretary Friedlander said, building back better. So thank you for that addition. All right, so I just want to look at our group here and, raise your hand if you have questions of our panelists. No question is too big or too small because we're all trying to figure this out in an unprecedented, extraordinary time. All right, I'll get us going then on a round, and please feel free to raise your hands if anything comes to mind. I want to move to innovation now, which you've mentioned some innovations. But again, thinking about our communities really owning this response next. Our state has led a statewide response under Governor Beshear, which has kept us all so safe and safe relative to other states. And now it's really incumbent on local communities to think about this very localized response to helping individuals recover from this pandemic. So what are some of the innovations that you might share with folks listening in here today that they can take to their local community? Innovations in post-secondary, responding to young adults, innovations in general, Marcy, like you mentioned, making sure we have mental health experts in our conversations. Because we know just going back to the ways of doing things before COVID are not going to help us recover and exponentially kind of increase our outcomes. We need new ways of responding. So what might some of those be? Secretary Friedlander, I think I want to pivot to you here, maybe to talk about Kentucky being one of these waiver states and using Medicaid.
Right. So part of the answer that I can give out of the Cabinet for Health and Family Services would be that and I will say this in general, I'm not going to limit it to Medicaid. We have really been pushing as much as we can, getting folks eligible for Medicaid, helping some of that economic structural support that families need. And that includes SNAP, that includes WIC, that includes, SNAP, which is formerly known as food stamps, WIC, Women's Infant and Children, which is a nutrition program for pregnant women and young children, as well as then we're looking at how we do some things differently, and our support for childcare, right? Those are pieces that I think making sure that folks can get eligible for those programs and not put up barriers, that's part of what we're trying to do. and make sure that we can have folks who can assist us locally in doing that. So that's my cabinet plug. Next piece, though, is I think a really big piece, and this is kind of, again, outside the cabinet, but that what we have seen is this digital divide, and we talk about it, right? But really addressing that, because what we've seen forever in our rural communities is this transportation challenge, right? Which limits people from actually getting to services. So learning a piece on how we have rolled out telehealth, keeping that going in understanding what's effective, right? We've seen no-show rates go way down when folks are able to provide that telehealth service. Now, from a local community level, and I think a lot of people are already doing this, or at least I hope so, is that outreach to the local community mental health centers. There are things called behavioral health services organizations. There are all sorts of things that folks can reach out to try to bring these collaboratives together. There's something that is this is going to get hard to describe quickly, but there's a state interagency council that works, SEAC it's called, and they're regional councils and they're local councils, although the local councils have fallen off. But I would say, look at that as a model, because that brings together all sorts of providers locally, including the schools, and bring together that sort of collaborative on a local level, I think would do wonders. It's called a local interagency council, right? A LEAC, regional REAC, and statewide SEAC. But bringing those folks together, right, to strengthen those collaborations, and it's behavioral health, it's DCBS, it's justice, it's education, it's everybody you need there. There's a great model that's out there, and to incorporate that on the local level and strengthen that on the local community level, I think we go a long way to really being able to have an effective community-based response. So that was another shameless plug. I apologize.
Secretary, I appreciate that so much. One of the things we've called for is communities to really come to the table right now and to be invited to the table as federal resources are coming into our local districts. And so it sounds like it's the LEAC, the local interagency council, that you're suggesting should be at that table.
Right. And you can, again, that's on our behavioral health side. If you look up that state interagency, you can see what that structure is. And there are folks who will be able to give advice, and consultants who will be able to consult with folks all the way from the regional to the local level to support the formation of that.
As we continue with a little discussion about innovations in our remaining 5 minutes, and others respond, I want to add into our conversation that while we're talking a lot about COVID, we're in a time that has been coined as a time of dual pandemics. And that second piece of the pandemic being the racial reckoning that we've been going through as a society and here in Kentucky. And Secretary Friedlander, I want to say again here, where the Beshear administration, I think, was really forward thinking and thoughtful in calling out the disparities early on in COVID testing and prevalence of COVID, and focusing on closing that gap, as it were. And I believe there's some success there that you might want to tout, and then we'll go to other panelists for innovations in these dual pandemics.
So I talk about it as a tri-pandemic, right?
Okay.
Opioid, substance use, equity, COVID, all of this has highlighted the differences and inequities across all sorts of systems. So I'll try to do this quickly. In the cabinet, we have 5 main pillars, right? Of course, health and wellness, of course, that economic support that I just talked about. I talked about that trauma piece, right? And the other one is equity, right? Leading with race. Because we have to. If we can figure out what those, and that intersection certainly of race and trauma, right? If we can figure our way through some of those things and come up with effective ways, right, to address some of those inequities, it's called targeted universalism. We will figure it out, right? That's our hope. The governor has been laser focused on making sure that, because we saw early on this disproportionate impact in terms of testing, in terms of outcomes, health outcomes in terms of deaths. Individuals who were Black and brown, right, had much worse outcomes in the beginning of the pandemic. We reached out with a 1, 2, 3, no cost to me campaign, which got folks, hopefully got some more folks covered through Medicaid. And by the end of the pandemic, the disparities there kind of went away. We still see a little bit of that in terms of vaccination, but we have been very intentional on reaching out into communities. Really, it's really that local community, local trusted voice that really makes the impact. So we've been focused on that, and we'll continue to focus on that. And really, each time we report on kind of the vaccine, we continue to go up in terms of our percentage so that it more and more reflects the population that we have in Kentucky. But that takes intention, that is something that I hope we can all, just like forming communities that can talk about behavioral health, that takes intention. So anyway.
Thank you
for that opportunity.
Secretary Friedlander, I think perfect, right? Intentionality. So as we move forward, intentionality. So others, quickly, popcorn innovations. Marcy, I saw you pop some great things in the chat box, and Goldie as well. So folks, focus there. Marcy?
Sure, a couple of quick things. Youth peer specialists. Employing them more, finding them, training them. Those are specific peer specialists with real on the ground training. So if you have someone who has a severe mental illness as a youth and knows someone else who has been through similar and they've been trained how to handle that, it's amazing. Family youth specialist or family peer support as well for those family members coping with someone who has severe issues. The more we help the severe folks, I think the more that trickles down for people seeing that everyone can get helped. Also, 50% of youth are not getting mental health services. That was prior to COVID-19 when they actually qualify for them. So that those kinds of statistics scare me. So making that availability and accessibility really come through. So with creative innovations, creative broadband, creative virtual, creative on-site school integrated services, I think those are all important ways to do that. Also, Al-Anon meetings for all those youth, right? Something based on Al-Anon, maybe we need to create something Kentucky specific, we can, but somewhere where those kids who have been impacted by the opioid epidemic have a way to actually undo that cycle and undo some of that trauma together and learn from each other.
Marcy, thank you. Goldie?
Yes, one of the things we haven't talked about was the mental health crises that often emerged when someone was placed in isolation and quarantine. I feel at this point I could probably write a book about just this subject entirely. But the innovation that we came to was that, first of all, we had to be in the moment with the student. We had to walk hand in hand with that student during that process, even though it was over the phone. We quickly linked with Pathways and got an agreement to have a counselor on site to be part of our COVID response team. And by October, we were doing mental health coaching with students that were in isolation and quarantine. So it wasn't just them signing up for mental health services, though we kept them connected when that was appropriate, but we had too many students turning us down when we offered that service and we knew that it was needed. So we began coaching for mental health. We began coaching how to survive isolation quarantine, how to keep your mind busy, your body busy, how to stay focused and survive it. And then I also put that with our nurses. The nurses doing the response also had to do that same kind of daily contact with students in isolation quarantine. And I want to say something about those students. Those students that chose to stay on campus in isolation and quarantine actually did the work, folks. They stopped the transmission of the virus because they stayed isolated and they survived it. And they really helped colleges hold the transmission down. They did the hard work. They took the hard road, and we have to pat them on the back from that. But Pathways was a good partner for us, and that mental health outreach really worked.
Kudos. Thank you, Goldie. Yes, a reminder that we were all part of a successful response as a state, and thank you for lifting up our students that way. Amy, last word.
Great, thank you. I want to jump in and sort of piggyback on what Goldie just talked about. What services they provided for their college students were a lot of things that we tried to provide for our elementary through high school students. The virtual, we had virtual spirit days. We provided different, scavenger hunt situation things. Students can do things with their families in their home or by themselves, but then they could take a snap of whatever it is they did or finished and post things on Dojo. And it was a way to communicate as a building. We could communicate through the classrooms. We could communicate individually. So that's where, again, Dojo came in. It was a really great resource because everyone's already connected. And it was a way to at least see each other and then have text messages back and forth about things that students were doing. And that was really great. It was at first the only way we had to see students were through snapshots on whether it was Google or Class Dojo. That's how we started those connections. And then it just grew out of there. And it was really, I was actually this morning before logging into this, scrolling through some of those, and I saw some where students had been outside finding leaves or bugs or whatever it was and taking pictures and posting. And it was just a really great opportunity to pull us all together and kind of maintain that positive mental health, because that's what we all need.
May I take
Secretary?
just one more second?
Yes.
Just one. I think that's a great example, because here's the challenge. We've all now learned that we can function virtually, right? We've now learned about how we function outside of our walls. And that challenge, I talk to hospitals, I talk to nursing homes, I talk to childcare centers, I talk to them all about how do we exist now that we know we have a broader and virtual community. How do we now exist outside our walls more and make our impacts more community-based than we've ever been able to think of before? So that kind of innovation, that kind of both outside and inside the walls of what is that concept of a school now, and what are the concepts around a school wall that maybe are very different now, that we probably should have always had, but now we have the opportunity to implement in a way that maximizes the school and community impact on each other.
Yes. Amen. If I can say amen, absolutely. Yes. So we're in this together without a doubt. Our schools need to be part of our communities and our communities part of our schools. And that's early childhood through post-secondary. Thank you all for joining us today. Secretary Friedlander, Amy Beal with Campbell County Schools, Goldie Williams with Morehead State University, and Marcy Timmerman with Mental Health of America, Kentucky. You all were fabulous. Thank you for all the resources you put into the chat box. We'll compile and get those out. And thank you all to those of you who joined us today and participated in this discussion. We'll be back in 2 weeks with another discussion. Stay in touch. And if you're not already a member of our Groundswell initiative for a big, bold future, there's a link in the chat box to sign up for the Groundswell initiative. Thank you all. Have a wonderful Wednesday.